Our first guests today are Tara Monsour and Kara Peterson of Novant Health Brunswick Medical Center Radiology Department. Welcome, Tara and Kara. Thank you so much for being here today, and I hope I can keep your name straight. It's like a rhyme. Well, you both work at the Novant Health Brunswick Medical Center Radiology Department. So tell me about your role. We'll start with you, Tara. Tell me about your role at Brunswick Medical Center.
Okay, I'm the multimodality supervisor of the radiology department. So I basically supervise the workflow from day to day and take care of patient care and make sure that the techs have everything that they need. And as far as the mammo department, making sure their schedule is set up properly and they have all the items that they need for day-to-day activity.
You said multimodality supervisor. What does that mean? What is modality?
Modality is as mammo. So you have your mammography department. That is a modality. You have your x-ray department, your CT department. So I have 7 different departments under me.
That's a big job, Tara.
It is. It is. I have a big responsibility, but I enjoy what I do. I do.
Yeah.
I enjoy what I do.
Well, Kara, it's nice to have you on the show today, and I love your pink pants.
Thank you.
Tell me what your role is at the hospital.
So I work in direct patient care and mammography, just taking patients back, doing the screenings, diagnostic, things like that. I work on the mobile unit as well. So I'll be in the department one week and out on the mobile unit the second week. So just mammography.
Well, thank you for sharing that. So October is Breast Cancer Awareness Month, and this is the month of October. So that's a really important topic. I don't think, I think the more you talk about it, the better we're all going to be. So we appreciate you guys sharing this information with us, especially around screening. So generally, at what age does a woman start to get her first screening mammogram? And then what about the men out there that need them? Talk to me a little bit about that too.
So women normally, if you don't have any family history, then you start at the age of 40. If you do have family history, we normally go about 35 years old. As far as men are concerned, we don't do screening mammograms on men, we do diagnostics. So men, if you have a lump or an issue with your breast tissue, then you would come in and we would actually do a diagnostic mammogram with a possible ultrasound to follow.
Wow, that's interesting. So how often, once you start having mammograms at say 40, how often should you have them in the future?
That's an annual recommendation.
So every year?
Yes, ma'am. So as long as it's just a screening, there's no problems, you'll come every year. If there was something found on your mammogram, you would come back, you know, depending on what the radiologist suggested, either a short-term follow-up, long-term follow-up, or you come back the following year for another diagnostic mammogram. But the recommendation for just general screenings is annually.
And I think most insurances pay for once a year.
Exactly.
Some things are a year and a day, or
Usually, most insurances now, they follow what Medicare does, and it's within the month.
Yep.
oh,
So it's not even the year and
That's
day
good to
anymore,
know.
so it's within the month.
yeah, because we used to have to be so careful about that date
We
and
did.
add a day to
We
it.
did.
Oh, well, that's
have to
great. So, Kara, let's talk about the actual process. So you're actually in the room conducting the mammogram. Is that correct?
Yes, ma'am.
So there may be some women out there who haven't had mammograms yet and they have no idea what to expect. So walk us through what that looks like.
Okay. So when the patient comes in, they register like they would for any other appointment. From that point, we'll bring them back from the registration area. They come back into the exam room. We have a series of history questions that we go over with them, personal history, family history, surgical history, things like that, OBGYN history questions that would relate to what we're doing. We go over those, and as long as the patient is asymptomatic as far as screenings go, we just go ahead to the routine exam. We'll do about 4 pictures usually, 2 of each breast. We apply compression to the breast during that, during the exam. I would not say it's painful. I don't like to use that term, but everybody gets these horror stories that a mammogram is so terrible, and it's not like that anymore. We do those images, and then once we're done, it takes maybe 5-10 minutes at the most. The patient will be good to go, and they follow up with results in a couple of days. depending on what the radiologist determines.
So, does the radiologist read it right away? Is there an initial read that's done right away so that if they see something, they might do something extra?
So as far as a screening mammogram, the radiologist normally reads it within a 24-hour period.
Okay.
If it's a diagnostic, it's read right then while the patient is still in the building, and the radiologist may even go and speak with the patient at that time as well.
In terms of getting prepared for the mammogram, you have dressing rooms where the patients are escorted to, is that
Yes.
correct?
Yep.
And then what happens then?
So typically we go through the routine to bring them back. They'll go straight into the dressing room. We'll get them changed. They put on a gown, so just from the waist up they'll change into a short gown that opens in the front. No deodorants, lotions, or powders. So if they came in with that, they'll have to remove that. But most of the time, the scheduling department, when they're putting them on, will tell them what to expect as far as that goes. So they'll change into the gown, and then we usually go over those history questions once they're ready, and then go into the exam.
This might be a dumb question, but it probably would be easier if women wore pants and a top,
Yes,
right?
exactly.
Because the gowns are short.
Right. We do have long gowns for patients that
So
do come in.
if I wore
yeah.
a dress, which often I do it, and I have mine at work, then there's something else I can wear rather than just a
Exactly.
little short one.
Right.
How
Yeah.
about jewelry?
That doesn't
Do you have to
necessarily
remove everything?
No, not necessarily, but necklaces, if they're bigger,
Long.
bulky necklaces, those will have to be removed. But a
Uh-huh.
long necklace, we can really just turn that around to the back. Earrings, if they're really long, we take those off. But just like little stud earrings and things like that, watches, jewelry, bracelet, on
Oh.
anything like that does not matter.
Okay. All right, that sounds good. And we talked a little bit about results, and you say if they identify something during that 24-hour period when they're reading the mammograms, then the patient, how would the patient find that out?
So the results, as soon as our radiologist signs it, if the patient has a MyChart account, it directly goes into MyChart.
Yeah.
And so then they get an email stating they have results, and they can open that up right then, and they know. Or their primary care physician, they actually get those results at the same time. So the primary care could also call the patient whenever they have a chance to review as well.
So,
We also send a letter in the mail letting the patient know the results of their exam.
but that's after, that would be later on.
That would be later, yep.
Later on. Will the patient, I know there's a new law that says that the information is released right away to your MyChart account. And so would the patient be able to see a bad result?
Yes, any
So
result.
that you need to be prepared for that.
You do. And the techs, whenever they, especially with the screening mammograms, they let the patient know whenever they're walking them out that they're going to get their results of their exam.
Oh, that's
and it
good.
could be, hopefully everything will be fine, but you get your results whichever way it may go.
And we always make sure to let them know that their doctor will follow up, especially if there is a significant finding. The doctor will follow up with them, and then they'll get a call from our scheduling team to get scheduled for that follow-up study.
So let's talk about where you can get one. Are there other resources? Does Novant Health have other areas or resources where you can obtain a mammogram?
We have the main location here at the hospital, but we also have the mobile mammography bus, which I touched on earlier. Most of the time, right now, Mondays and Tuesdays, we go out to the South Brunswick Imaging Center out Calabash area. We go there, like I said, most Mondays and Tuesdays, but there are some other locations we're trying to get into. Our scheduling team has access to wherever we go for that. Currently, that is only a 2D unit, so if the patient wants to have the 3D screening, they'd have to come here. But for patients that live on that side of town and would prefer to just come to the mobile, we do get a lot of those. It's very convenient for them. But like I said, we have that big schedule that the scheduling department works off of.
Tara, do you handle that schedule?
So we have a centralized scheduling team as far as if the patient wants to call to get placed on the mobile mammography schedule. But as far as getting folks signed up, like getting places for us to go to station our mobile mammography, absolutely. They can call me directly and we can get them, get the mobile mammography bus out to whatever facilities or places that may want us outside of their building.
So if there's like a business or a church group
Correct.
or somebody like that who would like to host the mobile mammography unit, they could contact you and set that up.
Absolutely.
'Cause I'm thinking of women's groups at church and stuff where you could do 20 people.
Yeah.
And,
Absolutely. And we're actually we're marketing now. We go out at least once a month, maybe sometimes twice a month. And we've been going to even communities to maybe go to some golf courses and things like that, just to even put the mobile out there.
That's awesome. How can women, where can they call to make an appointment? Now, they already have a primary care, so they need an appointment. How's that done?
They can call our central scheduling line, which we can give that information out. If you just want to know where we are, you can also go onto the novanthealth.org/gopink website, and it tells actually where the mobile mammography van will be that day. But just to schedule, just call the central scheduling line.
And I think that's 910-721-1485.
Yes, ma'am.
All right. I didn't realize the entire schedule was on there. So if you're looking for the mobile mammography unit, you can go to the novanthealth.org/gopink, and the schedule will be there. And it tells you on a daily basis where it is.
Correct.
Wow,
Correct.
that's awesome. You touched on one thing, 2D versus 3D. Tara, can you talk to me a little bit about that?
Sure. So as far as 2D is what a lot of folks, what we've always done. Now the gold standard is 3D. So it's still the 4 projections of the breast, 2 on each side, but it's a little bit longer of a projection. So you get to see more slices of a breast, I guess you would say. So you see more of a breast tissue. So as I said before, the 3D is definitely the gold standard.
And that's what we have here at the hospital.
That's what we have here at the hospital, and that's what we will have on our mobile. Hopefully in the near future, we are getting a brand new mobile, so we're very, very excited about that. So then we'll only offer 3D for our community.
Throughout
Absolutely.
our facility, it will be
Absolutely.
3D for everybody.
Yep.
That's awesome.
Yep.
I can't tell you how important I think this information is. Thank you so much for being here today. What would you say to ladies out there putting it off?
Don't.
Yeah, don't put it
Don't
off.
put it off. Your breast health is very, very important, and we are finding it a lot sooner these days, especially with the 3D. So we're able to start the process of taking care of those issues a lot quicker than what we have normally done. So please do not put your breast health off.
Yes.
It can make a huge difference. It
very
could
much
save
so.
your life.
Absolutely.
Absolutely.
Well, thank you so much for being here, both of you. It was great to see you, and I hope you'll come back. And congratulations on the
Thank
baby
you.
bump.
Thank you.
Thank you.
You're welcome.